On June 2, 2020, a federal judge unsealed the indictment that would seal the fate of a woman once hailed as the next Steve Jobs. Elizabeth Holmes, the charismatic founder of Theranos, stood accused of weaving a web of deception that threatened the very foundations of modern medicine. She promised to revolutionize diagnostics with a pocket-sized device that could run hundreds of blood tests from a single drop. Yet behind the sleek white lab coats and glossy press releases, the technology never worked. Theranos was born in 2003 in a Palo Alto garage, a product of Holmes's teenage ambition and a vision that seemed straight out of a science fiction novel. By the age of 19, she had secured a place at Stanford, only to drop out months later and launch her company with a modest seed round. The promise was simple: replace clunky, expensive lab equipment with a handheld analyzer that could deliver results faster, cheaper, and at the point of care. Investors, lured by the allure of a disruptive health tech unicorn, poured over $700 million into the venture. High-profile board members, former Secret Service agents, former secretaries of state, and even a former chairman of the Department of Defense lent an air of credibility that few could question. The narrative was masterfully crafted. In 2014, Holmes appeared on the cover of Fortune with the headline, "The Young CEO Who's Changing Medicine." She delivered keynote speeches at TED, sang the national anthem at a biotech conference, and cultivated a cult-like following within Theranos' walls, where employees were sworn to secrecy under non-disclosure agreements. The company's valuation ballooned to an estimated $9 billion, and Holmes became a billionaire on paper, celebrated as a visionary who could democratize health care. But cracks began to appear as early as 2015. Journalists from the Wall Street Journal, led by John Carreyrou, published a series of investigative pieces exposing inconsistencies in Theranos' claims. Laboratory experts pointed out that the proprietary Edison and Mini lab machines could not run the full suite of tests advertised. Whistleblowers described a culture of intimidation, where employees were penalized for questioning the data. In 2016, the Centers for Medicare and Medicaid Services, CMS, revoked Theranos' CLIA certification, banned Holmes from owning or operating a lab for 2 years, and cited serious deficiencies that put patients at risk. The federal indictment filed in 2021 listed 11 counts of wire fraud and 1 count of conspiracy to commit wire fraud. Prosecutors painted a picture of a calculated scheme. Holmes and her former boyfriend and COO, Sunny Balwani, knowingly misrepresented the capabilities of Theranos' technology to investors, doctors, and patients. They allegedly forged test results, used commercially available machines for most assays while claiming they were generated by Theranos' proprietary devices, and inflated revenue figures to sustain the illusion of a thriving enterprise. The indictment also highlighted the use of dry run demonstrations, where pre-recorded results were shown to potential partners to feign functionality. The trial began in September 2022, capturing worldwide attention. The courtroom was filled with former Theranos employees, each called to testify under oath about the inner workings of the company. One former lab director described how she was forced to sign off on test results she knew were inaccurate, fearing termination. A senior engineer recounted late-night meetings where Holmes demanded the data to look perfect before any public release. Balwani, sitting beside Holmes, maintained his composure, insisting that any errors were the result of unforeseen technical challenges, not intentional fraud. Prosecutors presented a trove of emails, internal memos, and video recordings that revealed Holmes's relentless pursuit of a narrative that did not align with reality. In a particularly damning moment, a slide from a 2014 investor presentation, showing a flawless test result from a single drop of blood, was juxtaposed with a lab technician's confession that the sample had actually been diluted and run on a conventional analyzer. The defense argued that Holmes was a visionary entrepreneur who overpromised, as many innovators do, and that the failure lay in the technology's immaturity, not criminal intent. They painted her as a charismatic leader whose ambition blinded her to the practical limitations of biotech. After weeks of testimony, closing arguments, and a jury deliberating in the early hours of a cold November morning, the verdict was delivered. Holmes was found guilty on 4 counts of wire fraud and 1 count of conspiracy to commit wire fraud. The judge sentenced her to 11 years and 3 months in federal prison, ordered restitution of $452 million, and prohibited her from serving as an officer or director of any public company for 10 years. Balwani, tried separately, received a longer sentence, 12 years and 3 months, reflecting the jury's view of his deeper involvement in the fraud. The aftermath reverberated through Silicon Valley and the broader healthcare ecosystem. Venture capitalists grew more cautious, scrutinizing claims of disruptive health technologies with a newfound skepticism. Regulatory agencies, citing the Theranos saga, announced tighter oversight for diagnostic startups, emphasizing the need for transparency and independent validation before market entry. Former Theranos employees formed support networks, sharing their experiences to warn future innovators about the perils of a culture that rewards hype over honesty. Elizabeth Holmes's fall from grace also sparked a broader conversation about gender, media, and the myth of the female tech founder. Some argued that the media's rapid elevation of Holmes, coupled with a fascination for a young woman defying male-dominated tech norms, contributed to a blind spot that allowed the deception to flourish. Subscribe to The Verdict for more stories like this.